But it's not all rosy. Our COVID numbers are starting to go up. Starting 3 weeks ago, our wastewater numbers started to go up, including here in the Triad for COVID. And you remember we monitor our sewage for COVID particles, and those numbers have started to come up. It had actually started to come up before Thanksgiving. And then now, after the Thanksgiving holiday, we're starting to see more cases in people. And we're starting to see more emergency department visits for COVID, which we'll talk about in a minute. That's not where you should be going for your COVID. And then we're starting to, in some areas in the country, we're starting to actually see some more hospitalizations for COVID. Here in the Triad, the numbers have come up a tad for COVID in our hospital, but it's still not real high. Now, let's put all this in perspective. RSV is down, almost out of the picture, kind of. COVID, influenza is still up high, but looks like we've come past peak and starting to come down. COVID down here, starting to come up. And we're still seeing probably about 15 times as many positive tests for flu as we are for COVID in the area. So the flu is still the one that right now. But I think by Christmas, if these trends continue, which my prediction is they will, we'll be entering more of a COVID time for circulating viruses and less of a flu time. Now, this is exactly what happened last year, actually. We did have flu in the fall, particularly in universities and some in schools. And then it went down by mid-December. But remember that last year, Omicron was the one that came around. That was at the end of December. And then we had a horrible, horrible peak, huge numbers of cases. In fact, we estimated 70% of people in the United States got COVID last January and early February. So that was a lot of cases. Our hospitals were packed, and we had a lot of healthcare workers out with COVID themselves, couldn't come to work. It was hard on our hospitals, and I really don't want to go through that again. So my prediction is I don't think it's going to be quite like it was last year for a lot of reasons. One, our population has more immunity in general, and we'll talk about what immunity, past infection and immunity means. More people have gotten booster vaccines over time, which has increased immunity. The subvariant strains of Omicron that are going around now don't appear to be any more severe than they were last spring, which is good news. So I think we're going to have less severe disease with this coming season. I think we'll have fewer hospitalizations due to it, and I think we will have fewer deaths. So that's my prediction for this. I'm not alone. There are other infectious disease experts who've been saying this as well.